my name is Cheryl Erickson and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today in Nutrition, Health and Safety, we'll be looking at Chapter 16 and Managing Emergencies. But before we get started, I just want to remind you to please read Chapter 16, as this video is not a replacement for your daily chapter readings. So when we look at emergencies, we have two types of emergencies that we typically respond to. The first emergency is any a situation that threatens the life of a child or children or presents a risk for injury or disability. Or we would have a disaster, which is an event that overwhelms available community emergency response resources, often results in widespread injury, death, and destruction of a property. The types of emergencies that we can see as well are health emergencies. This is very common, caused by a serious injury, severe health concerns, or potential deadly disease epidemic. So a health emergency could be an individual having a heart attack. A health emergency could be food poisoning. A health emergency could be a gas leak. So that's the type of an emergency. A natural emergency caused by nature, so it could be a flood, it could be a tornado. Technological disasters are caused by industrial resources and exposure to hazardous material. So it could be a chemical leak, it could be a train derailed and there's some kind of a spill. Attacks and threats to personal safety could also be a type of emergency, and so that's like an act of violence or a threat. We here in Manitoba, in licensed childcare centers, do have an emergency prepared plan for all facilities. So this plan has specific emergencies and how we would respond to them, from a chemical spill to a tornado to fire. So there's specific protocol and guidelines that we would respond to. So that would be our emergency management plan for Manitoba childcare centers. And so why do we have these plans? It's so we can analyze potential emergency threats and know how to respond. Removing potential hazards. It's an ability to identify how to access emergency resources that are available to us. Addressing specific site characteristics, planning for children that have special needs, so that could be your anaphylactic type of policy, understanding options for taking shelter, your shelter in place, and how to safely transport children. So that would be part of the plan. And how do you prepare for action regarding that plan? The first and most important steps in this is identifying your roles and responsibility. So in an evacuation protocol, you would have staff that have specific places that they might be responsible for. So for an example, in a center that I worked in, we had a cook as well as a custodian, and those two individuals in an emergency, their place to go to was to help evacuate the infant program. So they always knew that in the event of an emergency, I need to go to the infant area to help evacuate. Assembling first aid kits, you should have a proper procedure monthly when you're doing your fire drills, that somebody checks to make sure that everything that should be in an emergency kit is in that kit. How do you creating a blood spill cleanup kit? So what would be in that particular kit, and that it's always stocked. Compiling children's emergency information. It is mandated here in our childcare centers in Manitoba that all our emergency backpacks or emergency evacuation kits have all the emergency contact information for the children. How do we communicate to the parents? What's our plan on that? And that our emergency procedures are posted throughout the center. How do we access emergency response training? So we are mandated again here in Manitoba that all staff have to have first aid and CPR training. There's also specialized training involved with any child that is enrolled in your facility with special needs. So if it's asthma, that you know how to properly administer that inhaler, anaphylactic, you know how to use an EpiPen, seizure training, all the medications that might be involved with that. So staff are specifically trained in those practices, as well as you are to plan your emergency evacuations monthly. So not only fire drill, but practice your lockdown, move to your shelter in place throughout the year so that you are prepared in the event of emergency. Not only are you training your staff on how to respond, but you're also training your children on how to respond as well. Practicing drills, again, yes, we do that monthly, including fire, earthquake, tornado, lockdown. And there's a lot of things to consider within that type of training. We do have within the centers lockdowns where you should have a supply of water and some food, non-perishable items. That should be restocked as well to make sure that it's always available if you do need it. So do you have your emergency supplies, your family contact information? And as I mentioned, that should all be in your evacuation first aid bags. Things to think about in order to get everybody safely out of the environment and into that safe place. So practicing different scenarios is really important too. What is first aid? First aid is an action to address illness or injury for an individual, and there's 3 goals involved in that, and we want to preserve life. We want to avoid additional injury to anybody on that scene and to assist with recovery. And so there is a Good Samaritan Act that is there for individuals who are administering first aid, and it is a law to encourage people to help in an emergency, and it protects that rescuer from being sued for providing that emergency help. So the intention is good. Your intention is to help somebody out as best as you can. And so to be covered by the Good Samaritan Act, you must be volunteered. So you must volunteer to help. The person receiving help does not object. So if they're conscious, you need to verbally ask them. If they're unconscious, you just take over and you try to help them. They're not in a state to give permission. And the actions of the helper must be in good faith in an effort to provide with health. So that's basically sums up that Good Samaritan Act. You assess the injury of, you should first assess the situation. You want to make sure that by helping out, you going to see the individual being hurt, that there's no obstacles in the way to potentially hurt you, because you don't want yourself to be a victim. You're not helping if now you're a victim as well. So you look for signs as well after that for the type of injury that has occurred. If there's, electrical wires in the situation, is that safe for you to enter? Probably not. And my assumption, if there's an electrical wire, that's probably what has caused the injury. So if you move into that, you'll be the injured person. If it's an individual floating in water, you assess the injury, obviously it's probably a drowning because they're floating in water. So things like that to determine what is potentially going on. And for a child, you're going to notice maybe signs of distress. So for example, if you're looking at a child that has asthma, and it's outside and just like it was here last week with there was a lot of forest fires and a lot of smoke in the air. If you notice a child is short of breath, having a hard time breathing, maybe coughing, I would assess that probably it's their asthma and we need to get them their inhaler immediately. So that's a sign of distress, is a breathing issue. Observe the child's physical appearance, inspecting the child from head to toe for problems of sign or injury. So in this particular situation, maybe the child is laying on the ground below the climber and crying. So you don't want to move them because obviously they've probably maybe fallen off the climber, and you don't want to move them before you determine what, has happened, and talking to the child in this situation to find out where it is that they hurt. So each situation is going to present itself a little bit differently. Sometimes you're able to communicate with the injured person, and sometimes you're not because maybe they've lost consciousness. Universal precautions, what is that? It's a safety measures. Safety measures or practices used when managing bleeding or providing that rescue breathing, that air. And so you should always put on some rubber gloves in the event that you are handling blood. If you need to provide air to somebody that is bleeding from the mouth or face, you should use a one-way mask. One-way meaning you can blow air into the individual that is hurt and needing first aid, but nothing can come back to you. So it's got a one-way blocking valve on it. You need to watch for sharp objects as well within that scene that may pose a hazard to you as well. Use appropriate hand washing in all situations as well. In the event of an emergency where you're dealing with it, you're probably not going to have the ability to wash your hands. That's why rubber gloves are really good to just in dealing with any issues involving first aid. Putting on gloves if you're outside in the park just because your hands may be dirty from being outside when you're applying a Band-Aid or something like that. But when you do get near soap and water, to remove the gloves as well and wash your hands. And always dispose of contaminated material. So put your gloves directly into the garbage or a plastic bag with maybe the soiled tissue or gauze or whatever that may have blood on it, and tie it up and put it into a larger bag. What is basic first aid care? Looking at, say, falls under a fall and perhaps a head injury for a child, keep child motionless. So you don't want to move anybody that is fallen from something because you don't know if their head or neck has been injured, and you don't want to cause more injury by moving them. So you just need to keep them safe and contained until first responders arrive on the scene. Ensure that that child is that child awake? Is that child breathing? So things like that, you want to make sure that that the airway is open and that particular child is breathing. If they're not breathing, you are going to need to provide that CPR to them. Notice the height of the fall, seek medical help. If you see a child that has fallen on the ground and they are unconscious, immediately yell to somebody to call 911. That is an emergency, and there's some, they could have a body injury, but they also would have to be seen by a medical practitioner because they have lost consciousness. You don't know if there's any broken bones or head injury, so it's best not to move them. You can, if they've fallen off a climber and they stand up and they have bleeding from the knee, a cut or something like that, treat that minor wound with basic first aid, so washing it and applying a Band-Aid. Asthma, treating asthma with every child that does have asthma, they are going to have an individual health care plan. You should follow that plan when they have any shortness of breath or seem to be having an asthma attack. And so it will walk you through the steps of administering that inhaler and how long you should wait before you administer the inhaler again. If they are still having problems breathing, at what point you should call 911 or seek a medical treatment for that particular child. What is an anaphylactic shock? It's a severe allergic reaction that impacts the ability to breathe. So in this particular situation in a daycare, the child is having a life-threatening allergy and their airway is swelling, and with that they're having difficulty breathing. So some of the signs when we look at a child that is having an allergic reaction, that is you could see hives. So all of a sudden on their skin you notice red bumps. They're having difficulty breathing or talking. They feel dizzy or confused. Sometimes there's abdominal cramping and even vomiting, nausea. With this, you need to immediately call 911. You need to administer that EpiPen. While I'm administering that EpiPen, I would be yelling to somebody to call 911. We have a child that is having difficulty breathing, and or whatever age it is, you're administering the EpiPen. They need an ambulance. After administering it, lay on the back. Don't offer them anything to eat or drink. Their airway is swollen. They're having a hard time breathing as it is. You don't want to give them something orally that would potentially cause them to choke. And you monitor them. You know, if for some reason that EpiPen doesn't start doing its job, they may need CPR if breathing stops. Some other situations requiring that first aid. So these are nosebleeds often occur in the daycare center. So you're going to tend to that nosebleed and keep in mind universal precautions, rubber gloves, and keep putting that tissue on that child's nose. Just keep adding layers until that nosebleed starts. Gone are the days where the child's head goes back. You just sit forward. Let that blood automatically flow out, and some clotting should eventually take place where that nosebleed starts. Bitings, so a child is bit by another child, cleaning the area is a Band-Aid if it's an open sore. Bruises and bumps, sometimes ice packs are a good source when it's bruises and bumps. Burns, cold water, cold compress. Drowning is an immediate 911 call, as well as first aid applied. Electrical shock, again, 911. Foreign objects, tooth injuries, heat exhaustion, heat stroke. Seizures is going to be another one where if a child is having a seizure, hopefully you have a individual health care plan. It's a child that's had seizures before and you follow the plan. If it's the first time a child has had a seizure, then definitely that's a 911 call, as well as shock, keeping them warm and keeping them comfortable until first response gets there. So these are just situations that, again, each one having a unique way that you're going to deal with it. As far as disasters go, if it's a situation where there is a disaster happening within your center, for me, disasters could be related to a gas leak or something like that, where you're evacuated from your building. And so remain calm. You don't want to upset the children. You want it to be getting upset and uptight and isn't going to be helpful in moving everybody out in a safe way. Your main goal is to evacuate everybody safely and make sure everybody is accounted for. If anybody gets hurt, applying that medical first aid treatment is really important. Listening to the radio for reports to help guide you about what's happening. as well as getting to that shelter in place. Or if it's a lockdown, just following those lockdown rules until further notice, until somebody tells you otherwise. So those are kind of the steps that you take in order to make sure that yourself, your children, and your colleagues are all safe within that. Your shelter in place is going to be the place that you move to that's safe and secure while you're waiting to find out what is happening with your daycare, environment. So stay in your shelter in place until there's no more threat or harm. Lockdown, meaning you have physically locked down your building. You're in your classroom or your physical building is locked down. Nobody can get in and out because there could be potential threat within your environment or outside. So there might be an internal lockdown or an external lockdown, and you have practices that you're going to respond. You're going to get away from the windows, turn out the lights and things like that. Try to keep the children as quiet and as calm as possible. When you're evacuating and relocating, you requiring assembly of the children to move safely from one location to another. So you're relocating because of a potential harm or threat. So you want to do that as smoothly as possible to avoid further injuries or upset or chaos from instilling. Supporting children after emergencies. So, it could be a very traumatic experience. I've worked in an environment that had infants, and when we practice our monthly fire drills, it was a traumatic experience for the infants. The alarms go off. It's very loud. Not only does an alarm go off, but a bell rings. And we evacuate from the building quickly, and you're doing that when it's cold outside too. So they've had, a bit of a shock. So you want to be supportive, and you want to comfort them in hugs and reassure them that everything's okay, and that we just had to practice, and we just had to keep you safe. And then get them back to that familiar routine as soon as possible, and to get on with their day, because that familiar routine kind of sets the tone, and it gets them back into what they're comfortable with, and then they start to feel a little bit better. And really make sure you acknowledge the children's feelings that, if I know that was scary, but we have to do that to keep you safe, and let the parents know too. I always felt it was really important to send all parents an email or do a bulletin board posting, because that's something that the children might talk to their parents about, that happened, and you want the parents to know that it was just a practice, it wasn't a real emergency, so that they don't become upset as well. Addressing tragedies, there's always a lot of supports, in the event of a real emergency and somebody is harmed and an ambulance comes and takes them away, and maybe they've passed away. There's a lot of supports available to come into your environment and work with your children and your staff to go through that, that process before you get back to normal. Everybody feels a lot of emotions, and it's important to know how to direct those emotions into a positive way. So we want to get all the supports in place to help everybody involved in that situation. And also to continue to monitor that effect on children. We knew when we set off the fire alarms that it was gonna scare the children, and we tried to best prepare them for that event as well. Sometimes, depending on how young the children are, when you're telling them, they don't really understand. So until they get to a certain age, they're just gonna feel the same fear just fear until they get to that age where they understand what it is that we're, why it is that we're doing what we're doing to, of course, ultimately keep them safe and be prepared in the event of an emergency. So that does conclude Chapter 16 in Managing Emergencies. Please see your instructor if you have any questions regarding Chapter 16, or just to check in to ensure that you haven't missed any handouts or assignments pertaining to Chapter 16. you.